In this morning's health alert, while families gear up for the last-minute summer vacations and children head back to school for the 2024-2025 school year, health officials are urging parents and guardians to remain vigilant against vaccine-preventable diseases such as measles, polio, tetanus, and many others.
That's right. Joining us to talk more about the importance of being vaccinated ahead of the school year is Dr. Atul Grover with the Association of American Medical Colleges. Good morning, doctor.
Good morning. It's great to see you both.
Thank you for being with us this morning. Let's go ahead and start with what health experts are seeing in regards to diseases and if there are any spikes happening right now.
Yeah, well, unfortunately, as you think about getting kids back to school in the next couple of weeks, we've seen the rate of immunizations where kids are completely ready with all up-to-date vaccinations drop nationally from about 95% a couple of years ago down to 93%. That may not seem like a lot, but it means that 750,000 children are at increased risk for largely preventable diseases. So not just the things we've been talking about like COVID in the last couple of years and influenza, but also measles and rubella, diphtheria, tetanus. All of these things can be easily prevented with a trip to your pediatrician's office. And that's what people need to be thinking about right now as we get closer to Labor Day.
Oh, yeah. And now some parents may have many concerns when it comes to vaccines, but what would you say to them if they are on the fence?
Look, certainly you've probably got a bit of vaccine fatigue. We all have over the last couple of years. It's completely understandable. But remember that we have diseases like measles that we thought were gone 25 years ago now. In the year 2000, we considered it eradicated. But that won't last if we don't stay vaccinated. And we've already had about 167 cases of measles in the U.S. this year. Again, we thought this was gone a quarter of a century ago. And that's largely because the rate of vaccination has dropped for measles, mumps, and rubella. And the risk of getting that vaccine is minuscule. It's 1/1000th of any kind of risk that you might have from actually getting measles, which can be very severe in children. And about 1 in 5 children who get measles can get a pretty bad pneumonia.
Well, staying on the topic of children, why would you say it's so necessary for students to get vaccinated ahead of the school year?
So, number one, ahead of time is always better than trying to catch up in the middle of the year. People's lives are busy, and certainly our kids are very busy as well. Second of all, we know that kids are going to be back in contact with each other, getting themselves all exposed to germs that maybe they haven't been exposed to in a while, but then also coming home and sharing those with their adults at home, whether they are parents or grandchildren or siblings. And the rest of us may have higher rates of, really negative consequences from illnesses like COVID, and maybe lower chances of illness with things like measles, but they are there. And in fact, this is one of the easiest things we can do to prevent illness. We just need to get those rates back up. We need to start thinking about the world diseases beyond COVID now, many of which really are preventable.
Yeah, my mom taught school for a while. She was a teacher, and so of course it seemed like the third week she would come back and start feeling kind of sick, getting back and everything.
The third week and then every couple of weeks thereafter, right?
Yeah,
exactly. And now, what vaccines do you think parents should put at the top of their list ahead of the school year?
So that's going to be age dependent and kid dependent, but largely they're pretty standard in terms of measles, mumps, rubella, getting an updated COVID and flu vaccine for the fall, as we need to do every year, diphtheria, tetanus. We've also got much better vaccinations now than when I was growing up, certainly for hepatitis A, hepatitis B, HPV. Depending upon the age of the child, you really need to go talk to your pediatrician or other primary care provider or clinic, and they will have that list for you that works best for your children and your family, and you can have that discussion with them. But the other good news is you can give all these vaccines pretty much all together at the same time. And even though you may not love that, it gets it over with. You're done for the year, and you can go enjoy the school year and hopefully not be bringing home different respiratory illnesses to yourselves, your family, and the people around you.
Dr. Grover, this is some wonderful information. Where can our viewers go to learn more?
So one of the great sites is cdc.gov. That certainly is a great spot to get information about all vaccines. And if you are trying to look locally in Alabama, you want to go to places like UAB's website or South Alabama's website. And those are people hopefully you will trust. They are educators, they are researchers, and they've got a great set of information that you can rely on and take that into your pediatrician as well.
Absolutely. Thank you so much, Doctor. We appreciate you.
Thank you.